Good afternoon. My name is Blima Marcus, and today I'll be presenting my capstone project titled Analysis of Health Outcomes in New York City Children with and Without a Measles Diagnosis. My capstone advisor is Dr. Terry Wang. The agenda for this presentation is to provide a brief overview of the study, then go into more depth in the introduction and background, review the methods, then the results and discussion for this study, and finally, discuss the conclusion and future recommendations for this topic. The aim of this study is to determine whether measles infections has negative health effects on infected children. This was a matched cohort retrospective study and also a secondary data analysis. The results showed that children with measles experienced an average of 7.1 infections in the year after their diagnosis with measles, over twice the rate of uninfected children who experienced an average of 3.2 infections that year. Anti-infective prescription use was also higher for children who had a measles diagnosis. In conclusion, following measles infection, children do have higher rates of infections and prescribed anti-infective use, and this study supports prior research demonstrating immunosuppression in children with a measles diagnosis. I'm going to review two topics as part of the background and significance for this study. First, I'm going to discuss vaccine hesitancy, and second, we're going to discuss measles immunosuppression. Along with sanitation and antibiotic discovery, vaccinations are public health's greatest development. However, the World Health Organization has classified rising vaccine hesitancy as a top global health threat in 2019. Since the 1990s, vulnerable communities have been targeted by anti-vaccine lobbyists and activists, and these communities experience vaccine-preventable disease outbreaks such as measles, mumps, varicella, in very under-vaccinated regions. In 2018 and 2019, New York State experienced the largest measles outbreak in 30 years, with 1,200 reported cases and many thousands of unreported cases. There have been many attempts to reach to these communities and to improve public health trust and undo harmful misinformation, but more information is needed on how to accurately reach these people. Measles is one of the most transmissible viruses on the planet with high rates of complications. Studies have found that the virus infects and kills immune cells, causing an immune amnesia that can lead to secondary infections and severe outcomes for months and years after the acute infection. Children who have had the measles have showed a reduction in overall antibody diversity, while uninfected controls kept 90% of their antibody repertoire. Following measles vaccination programs, all-cause mortality in children has been shown to drop. These data underscore the urgency of maintaining adequate vaccination uptake. This study design was a secondary data analysis using the electronic medical record of a community clinic that experienced high rates of measles infections in 2018 and 2019. The final analysis included 98 children ages 0 to 5 with and without measles, matched for age and gender. The outcomes that I looked for were number of infections and number of prescriptions sent for 1 year post-outbreak in both cohorts. Potential confounders included prior healthcare consumption patterns, history of immunosuppression, cardiovascular disease, or pulmonary disease, or incomplete EMR data. To minimize these potential confounders, I only included children who had demonstrated healthcare visits for 1 year prior to their measles diagnosis. I excluded all children with a history of immunosuppression, cardiovascular disease, or pulmonary disease, and I excluded all cases and controls that did not have complete EMR data. Finally, for my statistical analysis, I used descriptive statistics as well as linear regression. Over here, you can see a breakdown of my participants by measles group versus non-measles group. You'll note that the majority of children were ages 1 and below. There was a significant increase in the number of males, 65% versus 35% were females, and none of the children who experienced the measles infection had been vaccinated, while 70% of children in the non-measles group had experienced at least one MMR vaccine. And finally, here you can see my outcomes by measles group versus non-measles group. I'm going to draw your attention to the bottom two rows, which are labeled total infections and total prescriptions. And you can see that the mean number of infections by children who had a measles infection were 7.1 infections for the 1 year following their measles diagnosis, whereas on the right, that number for the non-measles group was only 3.2 infections for that 1 year following the index case. And below that, total prescriptions for children who had a measles infection were 2.8 prescriptions sent in that year following their measles infection, compared to 1.4 prescriptions sent for the non-measles group. These results demonstrated statistical significance in both outcomes: much higher increase in infections in children who had a measles diagnosis, and a higher number of prescriptions sent, again in children who had a measles diagnosis. This data supports prior studies on children who had a measles infection that demonstrated an immune modulator effect from the measles infection. The strength of the study is that this is the first study to analyze the health of a very insular and vulnerable population that is not usually amenable to research from outsiders. Second, this was a matched cohort design. And third, one of these strengths is that this does confirm prior data. The limitations include possible incomplete health records, and there's a lack of full demographic data. In conclusion, the results of this secondary data analysis support the hypothesis that infection with measles virus is associated with increased adverse health effects beyond the acute infection phase. Parents do need accurate and accessible information so that they can make good health decisions for their families. And the dissemination of these findings will remain critical as parents struggle to make these health decisions amid an era of misinformation. Demonstrating that there are adverse health outcomes after measles infection may be important information that will influence parents to make good decisions regarding vaccination. And finally, including local community providers in all aspects of healthcare, including all phases of research and dissemination of results, is an integral component of culturally competent care, and it may assist in facilitating trusting relationships during fragile times.